Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafide, and welcome back to our Healthy Living edition of KUAM News Extra. With me is Dr. Jitka Lom from Express Care, located in the Agana Shopping Center. It is that time in our program where we field your questions. And our first question comes from Sarah T. in Nimitz Hill, who asks, I know 3 people that have both eczema and asthma. Why are these 2 conditions linked? If someone has one, does that mean they'll develop the other?
Very good question. Well, some of my patients will come and they'll say, you know, I think I have skin asthma. And it's really true. If you are a child that has eczema, which as we talked about last week is itchy, dry, and sensitive skin, that skin is broken, and so things from the environment can get into it and can trigger off release of chemicals. Those chemicals will then circulate through your bloodstream and into the lungs, and then in the lungs they can trigger an asthmatic reaction. What is asthma? It's constriction of the blood, of the small airways in the lungs, so it becomes very difficult to breathe. It's like trying to breathe through a small straw, so you'll hear a whistling sound or wheezing. So to answer the question, if you have eczema as a child, you have about a 50% chance of developing asthma later on. That's something that's called the atopic march. So some people will march along from just mild eczema along to more severe skin problems as well as asthma.
Our next question is from TNC. They write, my sister is into holistic medicine and told me to try a Neti pot the next time I'm congested. Does this work?
It actually does. Neti pots go back thousands of years to India, to Ayurvedic medicine. And what it is, it's a small teapot. It looks like a little teapot that you fill with water and a little salt. So you've got a saline solution in there. And then you drip it into one side, into one nostril, and flush it out the other side nostril. So it's kind of a flushing mechanism. It can be a little unpleasant if it goes down your throat and chokes you, but okay. if you do it the right way, it'll go this way and out the other side, and it'll flush out the mucus. And the reason that works is because the mucus, as it's inflamed, becomes thick and sticky, traps a bunch of germs in there, and the little cilia, the tiny little hairs that we have inside our nostrils that move germs and bacteria out, can't work very well. So by unplugging them, flushing everything out, those little hairs can do their job a lot better. Neti pots they cost around $20. You can buy them in a pharmacy or sometimes online, and they're a nice, cheap, effective way to deal with allergies and sinus problems. Yeah.
Our next question is from Dave. He's from the village of Jotnya. He writes, are there certain times of the year when you're more prone to develop a sinus infection?
Well, I think it just really depends on what you're allergic to. If you're allergic to molds, rainy season is going to be very hard for you because molds really go crazy at that time of year. Sinus infections, as we mentioned, go along with congestion. So any time of the year when you're going to have more congestion, you will be more prone to infection at that time.
Mm-hmm. You know, our guys in the back were mentioning, what about during rainy season?
Right. So if you're, for example, allergic to a lot of pollen, the pollen count is lower during rainy season because the rain flushes the pollen from the air onto the ground. So you won't have as much of that in the air, so you'll be better off. But if you're allergic to mold, it's worse for you at that time of year. So it's six of one, half a dozen of the other.
Okay. Our last question is from Amy from the village of Barrigada. She asks, I have major animal allergies. I get sneezy and puffy eyes whenever I'm around dogs and cats, but I really want to get a puppy. What can I do? Is there any medication I can take, or is there a breed of dogs that don't cause allergies?
Well, it's good that Amy's thinking ahead because it's way worse when you've gone to the game shelter, picked out your puppy, and then have to give it back. But to answer her question, there are certain hairless breeds of cats and dogs that you can get. The part of the cat or dog that she's allergic to is actually their saliva or their dander. The dander are the dead skin and hair that falls off the dog as it ages and as it just through regular life. So in order to avoid allergies, you would try to pick a dog or a cat that has little saliva and not much dander. So short-haired dogs or no-haired dogs, a good kind would be a poodle that you would shave and have very, very short hair on it, and then wash it frequently to get the dead skin cells off. But she may need to take medication every day for the rest of her life while she has a dog, and she may regret that decision, so maybe she should get a loaner first.
Well, thank you so much once again for joining us. If you've got a question for Dr. Lom, next week's topic is actually pigmentation problems. So you can check us out and post your question on KUAM.com or on our